So today I'm talking to you all. Not so all of you would have come with a lot of curiosity, expectations to know what this lecture is about. And generally, if I speak on an endocrine topic, then at least I'm considered to be an expert. But when I speak on presentation skills, definitely I'm not an expert. So I'm someone who is learning like you all. And then, so I'm not talking from a pedestal of superiority, rather, I'm among you all another presenter who is trying to share his experience with you all. So this is the kind of feeling that I have in my mind. So I'm not too sure whether I will do justice to you all. So basically, in today's presentation, what I thought was, rather than going through what is there in books about presentation skills and what, like there are YouTube videos and all. So I thought to make it more authentic, to put into slides the thoughts that were coming into my mind as a presenter, what I would generally do. So when you have to do a presentation, there are three components. It's the audience, then the presenter, that's you, and the message. So using this message, you are going to connect to that audience. So that particular message, so sometimes you will attend a lecture and say, that was a really good lecture. And if somebody asks, like, what did he or she say about this particular topic, you won't remember. So because whenever we attend a lecture, that does not mean each and every point we remember. So we will take home 2 or 3 points. If you can take home 3 points, that means it is a successful lecture. But overall, it is that experience that you gain by being in that lecture. Okay. So then you have to look at it in that totality. So the experience that you give the audience plus the points that your messages that you are giving them. So in order to uh, elaborate further on that, I thought I will put this into 7 tips. Okay? So the first tip is you have to enjoy what you are doing. You have to be really passionate about that lecture. So from the time you start preparing for that lecture until you finish delivering that, you have to do it happily. Halfway through, if you sort of think that I'm not going to do it, it's taking a lot of time and all, then the outcome will be poor. So here you can see that's our president, Dr. Manjula Hera. So generally when Manjula calls me, I always answer the phone because he's my friend and I like to talk to him. But now when Manjula calls me, mostly you will see missed calls because it's not Manjula Hera who is calling me. It is the president of Kandy Society of Medicine. Okay. So when the president calls, most of the time it will be Charles, shall we go to Davalapitiya? And there we are having a combined session. Can you do a lecture? So that's the kind of call you will be getting. So then mostly you will, when you are busy and all, you will try to avoid it. Okay. But if you say yes to Manjula, after that, then there's no going back. From that time onwards, you have to enjoy what you are doing. But until then, you can say no. But if you say yes, then you have to put your heart and soul into it. Then the second thing is you have to understand the audience. So when I say understand the audience, now sometimes you may be doing a lecture to PGs. Say PGs who are preparing for the MD exam, you are doing a lecture. So all of them will be very attentive because they know that they have to get as many points as possible from that lecture so that they can do well at the exam. But another group like y'all, out of curiosity, you have come here because there's no exam paper at the end. So the speaker has to put in a lot of effort to make sure that he captures the attention of the audience. Okay, and then sometimes afternoons there will be a lecture. So depending on that, you have to see what kind of audience you are talking to, and then you have to target it to that particular audience. Next is you have to plan the presentation. Now, this is one topic given to me, pituitary apoplexy. So the conventional thing will be, if you look at the book, it will say epidemiology, etiology, clinical features, investigations, management, and further research and things like that. So if you are going to reproduce what is there in the book, then they don't need a presenter like you, because now there are text-to-speech apps. It's a matter of taking an article and then using that app, you can connect your AirPod or something, and then you can listen to it. So when you plan, you have to be very creative and you have to be very independent. Okay? So don't try to limit yourself to any framework that is given in any of the textbook or paper or something like that, unless it is exceptionally good. So here what I did was, when I had to speak about pituitary apoplexy, I did my own literature search. So there I thought there were 3 points. So this hinged on 3 points. One is when to suspect pituitary apoplexy. Next is the importance of giving steroids, because they will have adrenal insufficiency. So if you don't give steroids, they can die. And then when to refer to the surgeon for surgery. Okay, so then if you take it like that and give it in a different way for the audience to understand, then you have made your lecture special and the audience also will understand. So after that, I went on expanding on each of those topics. I'm not asking you to remember any of those things, so this is not the intention of this. So these were steroids. And then some cases and about surgery. And finally, again, I came back to the same this thing. And then I tried to give an important point: suspect any patient with acute onset severe headache, you suspect pituitary apoplexy. All patients should be empirically given parenteral glucocorticoids. And then don't deny or delay surgery to patients who require it. And again, take home messages, you have those 3 points. So then you start with 3 points, expand those 3 points, and again you convolute on those 3 points. So then you have given a definite message to the audience. Okay, but if you are just gone by epidemiology, clinical features, and all those things, you are not really, because you are just reproducing what is there in the literature. Then the start is very important. Whenever you do a lecture, according to research, what they have shown is, within the 30 seconds, first 30 seconds, the people in the audience will decide whether I should really listen to this lecture or whether I can just ignore that. So then that first 30 seconds is very important. The way you come to the podium, where you start the introduction and then the initial slides. So now, once I had to do a lecture on diabetes mellitus and cardiovascular disease. So if you look at the points, diabetes is a common problem and it is a major health burden in Sri Lanka as well. And most patients with diabetes, they die early. And then the commonest cause for that is cardiovascular disease. Therefore, we need to reduce cardiovascular disease in patients with diabetes. So you can tell like that. But to make it more interesting, you can do it in a different way. So then the end. So when I went to upload this presentation, so the technical person who was there, he asked, Dr. මේකද පළවෙනි slide එකද අන්තිම slide එක? So I said, nah, very good. ඒක තමයි මටත් ඕන වෙලා තිබ්බේ. මේක තමයි මගේ පළවෙනි slide එක. Okay. So then I said, people who are born in this world, they will all die. But in patients with diabetes, they meet their end early. Why? And then I show the evidence also in literature, because they lose around 7 to 8 years in their lifespan. And when you do that, you have to put the reference also, because whenever you make a scientific presentation, it has to be authentic. So therefore, always make sure that you give the reference as well. So after that, I'm saying cardiovascular disease is the commonest cause for that. Therefore, in order to reduce mortality, you have to focus on reducing cardiovascular disease. And how are we going to do that? So then there's a big difference between giving those points one after the other and being a bit more creative at the beginning, then people will know, okay, it's going to be quite interesting, so we have to be more attentive, right? And then again, I had to do a lecture for the psychiatrists about 2 or 3 years back when Dr. Gihan was the president. So the time given to me was 2 p.m. So 2 p.m. is the time after good lunch at Grand Canyon Hotel. I knew all the psychiatrists must be waiting to sleep. They'll zone out. And then when it comes to a psychiatry lecture, okay, now when the audience is like composed of psychiatrists, if it is a lecture on a psychiatric topic, they'll be more attentive because they know there'll be question on those particular things when it comes to the exam. But when an endocrinologist talks to them, they know anyway we are going to refer the patient to the endocrinologist. Okay, but it's nice to know. So then when the audience is like that, the effort that you have to put in is more because you will make it much light-hearted, much simpler, and that's how you have to start. So then there, I said, I don't know how, and then I put in this picture. And he was the president at that time. Okay, okay, then also show this. Then the psychiatrists who probably would have thought psychiatric lectures are, they will be watching you. Okay, so then that's how you start. So that start is good. And then another way of starting that is with a story. Okay, because stories are also quite captivating. So here I had to talk about the approach to a thyroid nodule and endocrinologist perspective. So now thyroid nodule, what happens? When you have a nodule, your main question is whether it's malignant or not. And then you have to evaluate to see whether it is malignant or not. So then I started with a story. It was actually a true story. So then these are nurse who was working on a surgical ward, and then a thyroid nodule was detected. So she went to her consultant, so obviously the general surgeon, and then she asked him, is it malignant? Because if we get a nodule or lesion, our first question is it malignant? So then he said, okay, we'll do surgery. And then he operated on it, and the histology came as benign. So then the question that she asked was a valid question, whether it is malignant. Then surgeon took it out, and if you can examine the histology, that's the best way to say whether it is malignant or benign. And then the nurse was also happy. The surgeon also had a sense of accomplishment. But 1 week later, the nurse comes with a seizure. So she has developed post-operative hypoparathyroidism. So it did not end in a good note. So now she has developed a complication of surgery. So then she had a benign lesion. So the question was correct. Surgeon gave the best possible answer because there's no other way in which you can distinguish between benign and malignant. But 95% of the time, it is benign. So when you have a benign nodule, are you going to always do surgery with all these associated risks and tell the person it is benign? No. So it is like, so at that time, the Ratapusala, that incident was there. So I said, here what we are doing is, we are using live bullets when we can possibly use rubber bullets. Okay. So there could be less invasive ways of doing that. So then the problem was, we should try to use a rubber bullet rather than a live bullet. And then that's why we use this functionality, ultrasound scan, FNAC. By these methods, we try our best to say that this is benign and avoid unnecessary surgery in these patients to say whether it's benign or malignant. So then you are setting that context with this story. After that, you can talk about each of these things and how they help with this thing. So then you can captivate with the audience by having a funny this thing, or sometimes a really good story, which is going to set the context. And then the other thing is you have to keep your lecture quite simple. So some of us, we might think always you have to show a lot of data, crowded slides, and then people will think he's very sophisticated, he's reading a lot of literature and all. So finally, it is not going to work, but there is something called cognitive load theory. So that means the working memory is limited. Our RAM is limited. So then if you overload it, it will have a negative impact. So when you read, you can read a lot of complex things, take your own time and understand it. But at a lecture, within a short time, for a few seconds, if someone puts a lot of data, tables and all, then you're not going to learn anything. So finally, it's going to give a negative impact. So finally, my duty is to teach you something rather than telling that I know a lot of things. So then people, it won't reflect good on me. So now here I had to do a lecture about a few weeks back at our annual conference. So the question was apoplexy, when and when not to operate. Okay. So this is the endocrine conference. When I have to do a lecture at the endocrine conference, you're going to have the endocrinologist. So there, I can't be doing a lecture for the KSM audience on apoplexy because the audience is totally different. They will want to know what is the latest, what kind of data is there, what should be there. So then you have to pitch it at a different level. So when you do that, so here the question is, the patient, one is conservative and the other one is medical. So answer that, I have two options because it's option. And then I something like that, again, setting a context. But after that, it's going to be data. So here the first thing I want to show, in the 1980s, at the beginning, people thought surgery was the only way to manage pituitary apoplexy. So therefore, from the data, I highlighted the year. Okay, because basically what I'm going to tell is, in 1983 and 1993, people thought surgery was the only way to manage pituitary apoplexy. But it has its complications. But in 1978, interestingly, there was this observation, 9 patients who were managed without surgery, they showed remission. So here, its timeline is what I am trying to highlight here. And then based on that, in Brazil, there was a study in 1995. And then again, I have broken it because this study I had to give a lot of details. So then after doing that, so now these are only a few slides, right? So there are a lot of slides. So then for the first question, why do we have 2 options? I thought of summarizing that. So earlier I said we go from 3 points, expand, and we come back. So here, each point, it's not that kind of a pattern, it's a different thing. 3 questions that I'm trying to answer. So the first question, so you can say bottom line or summary or something like that. And then it is possible to manage pituitary apoplexy conservatively. Surgery is required in patients with visual disturbance and impaired level of consciousness. So like that, I summarized that and then I went to the next section. So then otherwise, if you go to summarize everything at the end, sometimes it'll be too confusing. So then you just put it as a package and then you go to the next one. So here also, I want to show the epidemiology of pituitary apoplexy and to show that it's very uncommon. So then first, this thing you can see, I have shown the inhabitants. It was in Oxford, 81,000 patients. 63 had apoplexy and only had pituitary tumor and only 5 had apoplexy. So then that you can highlight it in a different way. Then people will remember 63 and 5. So after that, another study, it was only 0.17. So like that, you should know which part has to be highlighted. Otherwise, if you expect the person to know everything, do you think you can like grasp everything on this slide? No, it's going to be difficult. And then again, another one, just skip that. So here, when I read the article, this page, it had a lot of tables. So then if you have tables and then certain graphs like this, those are very useful. So you can use them to present your point. Okay. So when I took that table 5, it was like this. So here, if I start talking about surgical versus medical, some of you will understand. Someone like me, I find it really difficult when a lot of numbers are there like this. So someone has to assist me. So I know the p-value is there, right? And then it is more than 0.05. So therefore I know that it's not significant. So if I just talk like that, it's going to be a little boring for you. So then what you can do is surgery versus conservative. That's our question. So then this is that US study because I initially referred to that study which had 100 patients. So it's a fairly good number for pituitary apoplexy. And then I'm trying here visual field recovery at 3 months. There was no difference. So you highlight that particular part and you give the conclusion. So then it is very easy for that person to grasp rather than just talking based on the original table. And here this graph, it shows how each person's tumor size it reduced. So then that's another way of showing that. So then conservative management, each patient's tumor volume it decreased. A substantial reduction in the tumor volume. So if you tell like that, it will be easier for the person to understand. Again, I'm summarizing that. And after that, you go. And now there was another scoring system called pituitary apoplexy score. So here, surgery versus conservative. You're not supposed to understand that. What I'm trying to show is, so you can highlight the two. These are the two things that we are trying to compare. And if the scoring system is, if it is score is less than 4, it is conservative. If it is more than 4, it is surgery according to this study. And the next study, if the score is less than 3, it is conservative. More than 3, it is surgery according to that study. So like that, you can use different kinds of these things. So I'm not too sure whether I can go to this PowerPoint presentation. I'll come to that later. So here what happens is in PowerPoint presentation, you have different shapes. So then using those shapes, you can do these things because now this laser pointer is working. But always it won't work because if you go to a big conference, that LED screen light is more powerful than this laser light, laser beam. So then even if you shine, you won't see anything. And then computer also, you have the cursor. I'm operating the cursor, but you can't see it on the screen. Okay, so all these technical glitches can happen. So therefore, if you highlight it like this as part of your PowerPoint presentation, then you don't need any other assistance. Okay, so you can do that. And then whenever you see a forest plot, you can use that also because it gives a lot of information, the confidence interval, the line of null hypothesis, whether it is crossing that or not. So then those who know statistics, most of us, we know this. So then we will find it much easier to grasp what is there. And then you have to, tip 6, you have to make it authentic. So when you go for a lecture, always if you are going to say what the others have told, then for that audience, it is not like that connection is not there. What the British people have told, what the Americans have told. So you have to bring it closer to you. So if you have your own research, it may not be up to the standard of that particular research, but you can say in our unit also we studied these patients. So the TSH, to have a normal TSH, thyroxine requirement was 1.49 micrograms per kilogram. So when you say like that, or it can be a case report that they have published, or it can be your own cases. So Manjula can show, I operated on a patient the other day. There was a 3-kilogram tumor that the photo that you showed. So then if we have those photographs, then it will become more authentic and very close to us. Okay, otherwise you are just reproducing something someone else has told. And then you have to use PowerPoint effectively. But in this forum, I'm not in a position to do everything. But here, this one example. So when I started, so my journey saw an evolution. About 2 years after I came to Kandy as a consultant, I was asked to make a presentation in Colombo by Dr. Anama Siribadana. So then this is how I have prepared the slide at that time. Okay, so management of diabetes in patients receiving TB treatment. So use the frequent contact with the patient during TB treatment to help manage his or her DM in the TB clinic. There should be a glucose meter in every TB clinic and blood glucose should be frequently checked in the clinic for those with DM. Okay, so then I also would have read it those days. Okay, and then the audience also would have read it. Finally, they also wouldn't have understood anything. I also at that time wouldn't have understood anything. So this is how I have presented way back. Now, probably I would have said management of TB patients receiving TB treatment. Frequent contact is very important. And glucose monitoring is important. Each visit, you have to have a glucometer and monitor their sugars. And you have to make sure that you give lifestyle advice to these patients, and you have to reinforce these facts each time they come to your clinic. In case they have any special needs, you have to always refer them to a specialist diabetic clinic. So now that is easier to understand, or this is easier to understand? So this is easier to understand, but you should be thorough with the subject. Okay. But same thing, you can go beyond that, and you can probably put it into images, because at the same time, nobody can read and listen. So, but seeing, it's much easier. So I would probably say, so frequent contact is important. And then about the glucometers and lifestyle modification, and refer them to a specialist clinic. So here, all these images, you can get it from the internet, and then you put them, and then you can combine with text and image like that. So you have to have very little text on the slides. Okay. So if you have more text and if you clutter it, you also won't be able to say what it is. And then the audience also won't understand what it is. So then there will be images. So sometimes when we take an image and then copy it on the slide, there'll be a lot of blank space around. Okay, so then that doesn't look nice. So you have to get the maximum out of that space. Okay. So here you can see a flower, and then you can also see a bell. But in a medical, this thing, say you want to show the face and you're not interested in the hands. Okay, so now what happens is, to fill it up, if you think I can really drag it this way and this way, this is the type of image that you will get. For a medical image, if the face is dragged like this, if the lesion is dragged, then the proportions are all wrong. You're not going to get the correct idea. So here what you can do is, you can go to this crop option, and then you can crop it in proportion to this. And after, so that's the crop option that's there. And after that, you can drag it. So you can take it to this corner, then drag it. Then you will get a complete picture. But this bell, you have cropped it because you wanted to highlight the flower in your lecture. Understood? And then another important thing is, so there are two types of slides that you will get. One is 16 by 9. So that is this one, long ones. And then earlier KSM, I think this one, if they lower this, it is 4 by 5. So if you're going for a lecture, you have to first ask them what the screen size is. So for a 4 by 5, this thing, if you go with a 16 by 9, then you can't fill the whole this thing, just like this image. Okay, only a small part will be filled. And it will be long and both ends will be blank. But for a 16 by 9, if you go with a 4 by 5, the other sides will be this thing, or sometimes it will go out of that focus area also. Some of those lines you may miss. Okay, so therefore, when you go for a presentation, find out what the dimensions are. But big congresses and all, even College of Surgeons and all, I'm sure in their like invitation letter to the speaker, they give the dimensions. And the first slide, you would have seen me. I said, like, you would have come with so many questions, and then all of a sudden, this thing appeared. Okay. So there, what I did was, I used a exit animation. So animation, you have entry animations and exit animations. So exit animation, here what I did was, I used a white color, what do you call, shape there. And then around that, I took off this border. Then white on white, nobody will see. And after that, I made it exit the screen. So then you can see. So you can hide something and then make it appear like that. Or you can make it appear also like what I did there. And then the third, this thing is, you have to practice. So any presentation, the eighth tip. So any presentation, you have to practice. Okay. So what I do is, when I have these presentations, I don't go on deleting the slides. What I do is, now initial this thing, you will be copying and pasting from different literature. So that information is needed later for you to read and all. So then I will keep it as version 1, and then again start a new one called version 2, and then maybe version 3 or something like that. And then I say penultimate. So with the penultimate presentation, I practice and I see the time. So mostly what will happen is you will exceed the time. So when you exceed, you will have to delete some of those slides and some of those points. So it's really like heartbreaking, but still because you have made a lot of effort, but still because half an hour lecture, you won't be able to show those slides. But KSM, it's a 1 hour lecture. On another day, someone might invite you to give a KSM lecture for 45 minutes or 1 hour. Okay, or evening, sometimes there may be a gathering, so you get a longer time, then you can go for that. So therefore, penultimate, and finally, after timing, you have the final this thing. So then, when you take it to the presentation, finally, you will go with the last set that is final. Okay. Otherwise, if you delete everything, you're not going to retrieve all the effort that you have put in. It's in vain. So start a folder. In that folder, go on saving them as versions. Okay. Right. So in summary, first you have to enjoy the presentation. So from the time you agree to make that presentation, you have to enjoy it until it's over. Then you have to understand the audience, because different audience, their interest will be different. And then you have to plan the presentation. It should not be just a simple reproduction of what is there in the books. It has to come from your own creativity. And then the start is very important. It has to be a captivating start. And you have to always keep it simple and easy for the audience to understand. And you have to make it very authentic. So then always give your own experience, own research. So then it will make it more authentic. And then you have to use PowerPoint effectively. Unfortunately, in this setup, I can't, I wasn't in a position to show all the like live demonstrations, but you can use them, and YouTube, there are so many videos. And then you have to practice your presentation. Thank you.